cancel a clinic based on not having enough of the supplies that we need. So you're also going to see a lot of McKesson bills on the credit card statement of 12/29/20 to 1/14/21, 4702, 852.69, 249.84, 409.87, and 332.90. There's also a charge for the Academy of Lactation for Caitlin Jeranek to be recertified as a certified lactation counselor. On our warrant of 1/12/21, we paid our NYSACHO dues of $2,545.60 for 2021. And we also paid Kelly Services $3,127.25 for contract work for COVID-19. And we paid the WIC rent of $300 for Cato. That's all I have. Anybody have any questions?
Okay, I don't have any questions. Anybody want to move to accept the claims?
I'll move to accept.
Second?
I'll second, Elaine.
Thank you. Any opposed? Okay, very good. Thank you. Are we ready? Are we ready for Wegmans?
I'm here, Dan Purcell, if you can hear me.
We can hear you. Let's see. Eileen, do you want to add anything to or sort of bring the board up to speed on what's going on?
Well, I'm going to defer to Rich on that.
Sure. We have the board has received the hearing minutes, well, not the minutes, but the decision and recommendation of the hearing officer. A complaint was brought against Wegmans for violating the executive orders and the health code regulations pertaining to wearing a face mask and maintaining and their operations with respect to those regulations. The violation was brought. We had a hearing on notice to Wegmans. The evidentiary hearing is closed. We have a decision from the hearing officer and a recommendation to this board to find Wegmans in violation of the health regulations and to basically issue a fine on it. Mr. Purcell had requested an opportunity to speak to the board, and that has been granted, and here we are.
All right. Mr. Purcell, is there anything you want to say to would you like to address the board regarding the situation?
I would, and thank you all for allowing me to be present. And thank you for all of your work in promoting public health during this past year. I know that it's been a very difficult time for all of you. This issue is very important to Wegmans because it involves customer safety and employee safety. And we can't stress enough how seriously we have taken that. And that's a key point because I do believe there, at least at some point, there's been some commentary that Wegmans doesn't care about this issue or that they just don't believe in it. And I don't think that there's any way that you could come to that conclusion when you've seen what Wegmans has done over the past year to try to promote customer health and employee health. So I'll be brief. I know you have many items to cover today, and I think some of these things were raised in the various papers that were submitted. I don't know how much, if any of that, you all have read. I would encourage you, please, if you haven't, before reaching a final decision, to read our letter submission to the hearing officer in this matter, because I think there are a few things in the hearing officer's recommendations that may be, in our view, off a little bit. And that is, one, that the policy we have is to allow customers to just shop however they want. And that's not true. We've gone to great lengths to try to get customer buy-in and to list point blank that they have to wear a face covering to enter the store. The disconnect comes in what do we do in that rare instance, and it is rare, less than 1% of the time that there is a customer found either trying to enter our store or in our store without a mask. And what it appears some would have us do is to confront and physically try to force the person to leave the store. And that is a line that Wegmans has decided it can't cross. And in fact, that policy really is consistent with CDC guidelines issued in August, which say that you should not try to confront or in other ways physically force somebody to wear a mask. I alluded to that idea of 99%. That's a number that Wegmans has gotten from doing periodic checks. They have store managers at the front door regularly. They have store managers walking throughout the store. The one thing that they just won't do, and this has been successful, because in the years since this all started, and Wegmans was taking these measures even before the state was in March of last year, it has had success. They've had over or nearly 1 million customers in that store during that time, and there has not been a single case of COVID-19 being contact traced back to somebody who contacted it at Wegmans. And so that is a success. And again, I know that this is by the letter of the rule. Someone was in our store not wearing a mask, but we don't even know if that person was medically capable of tolerating a mask. There's nothing in the report that establishes that. So I would, if the board has not, I would urge it to please read our letter submission to the hearing officer, and to please give us every consideration as we are trying everything we can possibly do to see that our customers, who again, these are customers that are in our store for a lengthy period of time. It's not the same as coming in and out of a Dunkin' Donuts or a Quick Stop. I mean, these are people that are in there for 20, 30, 40 minutes at a time. And to ask Wegmans to ensure that every minute of every hour of every day, that every person in the store has a mask on in every single moment is quite a high threshold. And I would also add that we've never had an issue with our customers, our employees, I should say, having any issues with masks violation. And that obviously is something we can directly control, and we have. So again, as I said, I wanted to try to be brief. I hope I have been, and I would be happy to answer any questions that board members may have.
Does anybody on the board have any questions at all for Mr. Purcell?
Well, I have a question. Mr. Purcell, why did Wegmans not sign the consent order if you agree that the regulations are valid?
Well, I guess that's with the not something we would agree with. The regulations we would contest that the regulations are valid because of so I guess it's two different things. When I say that we find this all very real, that's the issue of COVID. Whether the regulations are proper in the way that they've gone about this, in putting the store operator in the position of having to enforce it when the county itself and apparently police authorities do not. And so I don't know that I would say that Wegmans believes the regulation as written is valid, and also because it has in it several different loopholes, if you will, that would have to be proven. So it's both an issue of not that the regulation we believe has holes in it, but that in this instance, while you can say someone was spotted without a mask, we don't think a violation has been proven under the letter of the regulations.
And if I might ask, why do you feel that if somebody's not wearing a mask that we haven't proven that they're in violation?
Well, because again, the regulation itself, if you go back to the original regulations as written, say that a person has to wear, if they're over 2, and there's no one arguing here that the person wasn't over the age of 2, but that if they also have to be found to be medically capable of wearing a face covering. And it's an element of the crime, if you will. You can't prove that a person is in violation of this regulation, and therefore you can't prove Wegmans is in violation of this regulation without establishing that the person, who, by the way, we don't even have a name, so we couldn't even know who they are, but they could well have been not medically capable of tolerating a face covering, which under the regulation means they're not in violation. Beyond that, the testimony was that the one person that is the subject of this violation was at a checkout line, and there's no testimony about how far they were from other people. So another element of the regulation is that you have to have, if you can't otherwise socially distance. So now they're in a checkout line where they're behind a plastic barrier, and there's no testimony about how close they were to anybody else. So there's just a presumption that they weren't socially distancing. So if a person can't tolerate a face covering, or they aren't otherwise socially distancing, then you can have a violation. I should say that differently. If they can tolerate it and they're not socially distancing, then they have to wear the face covering. That's the way the regulation is written.
Yeah, I have a follow-up question. It sounds to me as though you believe, and I understand this is a very sensitive issue, and of course you're dealing with people who may feel very strongly about their position as far as wearing a mask. So no one is, I think we all understand how sensitive the issue is, and there could be a lot of conflict associated with that. But let me ask you this. What would Wegmans' position be if someone came into one of your markets and wasn't wearing any shoes, wasn't wearing a shirt, was doing other things that are contrary to the stated policy at Wegmans?
You know, I have not personally experienced that. I don't believe that is a rampant problem, nor one that is as charged, as you pointed out, as this issue is. I suppose they would be asked to either put on shoes or shirt or leave. But I don't think the analogy, I understand how you're using it, and it's a good one in some respects, but I think you'd have to agree that the reaction of somebody in 2020 and 2021 when you tell them to put a mask on is far different than if you told someone to put shoes on. And we've seen it firsthand. We've seen it with customers. So these are now people who, two customers getting into fights over these things. Now you throw on top of it the fact that Wegmans, as the owner of the property and sort of in a position of maybe denying people that, the ability to shop, that escalates it further. So I get the analogy, but I think they are different situations. And again, I'm not aware of any situation where that's been a problem, but I understand that you can make that analogy.
If I may, Mr. Chairman. The issue here is that the regulation itself puts the burden on the business owner, the business operator, to assure that their premises are safe for their customers and their employees, and specifically puts the burden on with respect to removing a customer who's not in compliance with the face covering. I disagree with the recitation that there was no proof as to the distance the customer was from the checkout, because I believe there was. And the hearing officer specifically found in his decision that there is nothing in the regulations that say that a sheet of plexiglass is a substitute for social distancing, or is a substitute for wearing a mask. So I would make the hearing officer's finding the fact support the conclusion that there was a violation in neither this board nor the hearing officer really has the ability or the jurisdiction to speak to whether this regulation that we are enforcing is written well or written right or written, pick the adverb you want to use. The fact of the matter is the state has placed this responsibility on local boards of health to enforce these regulations, and that's what we're here for. I would submit that, as I say, the findings of fact by the hearing officer more than support the conclusion that a violation has occurred and should be appropriately penalized.
Keith, you wanted to add something to the conversation?
Yes, not directly to this issue because I think the finding of facts are the finding of facts. But one of the things I do want to say, and to share is that I shop at Wegmans, and I shop there intentionally. And one of the reasons I shop there is because a number of years ago, I won't say how many. I don't actually remember. It's many years though. The there was a complaint in the store because one of the employees had rings. It was a man, had rings in his ears, was dressed in a way and looked in a way that was not acceptable in Auburn, New York, and to many people. That customer complained to management at Wegmans, and the response was this. The response was, the question was the person rude to you? No, they weren't. Was the person unhelpful? No, they weren't. Well, what is the problem? I didn't like the way they looked. The response to Wegmans management was, I'm sorry, then perhaps you don't want to shop here, because we support people's rights to look different. We support people's rights to be different, as long as they're good employees and they do the right thing for our customers. That's a reason that I shop at Wegmans whenever I can. And so it's my point with this is that the corporation does make the decision that some people maybe are not, I don't know why you call it Wegmans people. I mean, that's a terrible way to look at it. But that was an admirable thing, and indicated to me that the corporation is prepared to take a position to do the right thing, even if it costs them a customer or two. So that doesn't relate to this case, and I'm not suggesting that. Partly, I'm just saying that because I want you to know that I personally support the Wegmans. I support the corporation, and I will continue to do so. But let's, part of this now is to make certain that we are as you are committed to make certain we are all safe. So thank you for allowing me to say that, even though it's kind of off the topic and a little bit irrelevant, but thank you.
I appreciate it, Mr. Bettman. And I have said many times to Mr. Graham that I realize this regulation as written puts the county in a difficult position. So I please understand that Wegmans, in opposing this, is not trying to, we're not trying to pick a fight, and we're not trying to be contentious just for the sake of arguing, but we really do believe that we're trying to do everything we possibly can. And at a certain point, it just isn't possible to guarantee that somebody could come in and see one person without a mask for even a minute. And that's why we are challenging this. And I hope you'll understand it's not meant to try to do anything to suggest the county isn't doing everything that it can, because we know you are. So I will not say anything more, because I think I've spoken too much, unless there's other questions.
Does anybody else have any questions at all for Mr. Purcell? If not, I'm going to say that the board will consider Mr. Purcell's statement to the board, and we will discuss this a little later on in the meeting. Anybody else want to add to this? All right. Thank you very much. Thanks, Mr. Purcell.
Thank you again, and I'll hang up now. Thank you very much.
Thank you.
Okay. I guess we'll move on to Laurie, and then we'll go to Eileen after that.
Hello, everybody. So just a brief report on children's special health needs programs. Nothing really new or significant to report, but we are continuing to get referrals daily. So currently the numbers for EI, we're at 130 children. For preschool special education, we are at 190. I'm sorry, I'm trying to get my video up. For some reason it's doing it. Currently serving 113. So these are active open cases on all three of these programs. It's not including the pending referrals which is probably close to 50 if you count all 3 programs. There's currently 20 kids on a wait list in preschool special education waiting for a special education teacher. So that's pretty significant wait. And for speech, we're getting pretty close to going to a wait list. Service coordinators continue to work remotely, virtual, over the phone, whereas EI and preschool providers are pushing into the schools or homes, or some are still choosing to do virtual. We are down a staff, and then of course the staff are also working.
Does anybody have any questions for Lori? Go ahead, Kathleen.
Just to clarify, I know because Lori was blipping out just a little bit. I think as you cut out just at the end, Lori, I think you were also saying how the service coordination staff and support staff have continued to work in our COVID response as well. So that, we appreciate their help in doing that, along with, balancing their duties that they were initially hired for in their typical job.
Thanks. Elaine, I think, has something that she wants to add.
I was just looking to clarify the early intervention or the preschool special ed teacher wait list. Is that because there's not enough individuals willing to work, or there's concern about having the home? I mean, are you talking about 3 to 5 or EI where the wait list has occurred? And I wondered if it was capacity or the inability to make the home visit, or what was your sense of that?
Maybe if you turn off the video and just speak, Lori, it might work better.
I'm trying to, every time I have to get in a meeting like this, I have wicked issues with my computer. Anyway, you can hear me. So Elaine, that See It wait list is for the 3 to 5 program. And what I think occurs is you cannot be a See It teacher unless you are attached to an agency. So you can't be an independent special ed teacher. You have to be here to learn. So I went over to our county to work with these children. And albeit a lot of these kids this year have chosen not to attend a educational setting. So it's been really difficult to get See It teachers to push into home settings for that See It, because really a special education itinerant teacher is really supposed to be in support of a classroom teacher setting. So I think that's part of the issue too, but there just aren't enough special ed teachers that are coming over into our county to work, even though like Liberty Post, Here to Learn, whoever else has a slew that are servicing Onondaga County. And of course, their needs are triple or quadruple fold. They serve way more kids as would be expected. So it's just that there aren't the teachers that, I don't know if the agencies, I know they've been trying to, promote these positions, but I think it's hard to be a special ed itinerant teacher. But the few that we have are pretty full.
Thanks, Lori.
Yeah.
Okay, thanks, Lori. Does anybody else have anything else for Lori today? All right, thanks again. And I guess with that, we'll move on to Eileen.
Okay, so let's go through the consent orders that were in your packet. So the first one is with DJ&J Farms, that during an inspection, there was no measurable free chlorine residual in the potable water supply. The issue was corrected and they agreed to pay a $100 penalty. The next is with Napa Auto Parts. They had a violation of their workers not wearing appropriate face coverings. They paid a $50 penalty. The next is Auburn Bottle Return, that a worker was observed not wearing a face covering, and they paid a $50 penalty. The next is with BJ's, again, another, this one was a patron not observed wearing a proper face covering, and so they paid a $50 penalty. The next is with Drifters on Owasco. This is a restaurant that last year they had a positive back tea sample, and they failed to do the required repeat samples within 24 hours. And they also failed to submit their operating reports for September, October, and November of 2020. So they paid a $150 penalty. And then there's Tops Friendly Markets, where their employees were not wearing, an employee was not wearing a face covering, and a patron, and so they paid a $50 penalty. So those are the consent orders. So should we vote on that before moving on to the hearing officer's decision?
I motion to approve.
I'll second. Any opposed?
No.
Okay, the board accepts it.
Do we want to do Wegmans then at this point?
Let's move on to Wegmans.
Okay, so you have the hearing officer's decision in, it was in the packet of material, that our inspector reported that a customer in Wegmans had entered the cashier line and an employee without wearing a face covering. And so the hearing officer's decision was that they should be found in violation of the Part 66-3, the COVID-19 emergency regulations. They should be fined $1,000. And they should be ordered to comply with the provisions of Subpart 66-3 and ordered to amend their store policy so it's consistent with the requirements of these regulations.
Does anybody have anything they want to say about the consent order the way it's written?
I motion to approve.
Well, wait a minute. I'm wondering why they are $1,000 when similar situations were $50.
This is, they already paid a consent order for $50. Answer?
I'm sorry.
Yes.
I cut out too much. I couldn't get that.
Okay. This is their second violation. They were cited with a violation. I believe it was in August. I may have the dates off. But they had previously entered into a consent order for having violated the regulations. So this is their second go around. Typically, for a second offense and further, we don't offer the consent order. We don't offer a $50 fine, but we compel them to go through the hearing process and, the potential of $1,000 fine. Essentially, Wegmans has taken a position that they're not going to confront a customer regardless. And in this particular case, there was an individual at the checkout. There was testimony from the store manager that, they have assistant managers, they have other management personnel around, and that a cashier, if they have a question or a concern, they turn on their light and management will come over and address it. But in this instance, and they said as a matter of course, that they do not address the patron who is not wearing a mask. And so the rub here really is a policy question. Their policy is we're not going to confront a customer who is not wearing a mask. They said that they had the possibility of approaching them with their asset management folks or other management level people, but they don't implement that opportunity or that option. But unfortunately, the regulation itself puts that burden, that responsibility on the store owner. So that's, I suspect that if they are fined in this case, they will probably take it up and try to argue in Supreme Court and that the regulation is improper as written. But that's not an argument to be made before this board.
Yeah, I couldn't agree with you more about that. If they have a legal argument, this is not the venue for that. And for us to be consistent, to follow the regulations as written, obviously, if they're proven to be illegal or unconstitutional, that's a different matter. But to follow the regulations as written and be consistent for everyone, regardless of their size, their power, or their lack of size and power, and really consistently follow through. And I think that's the main issue that we need to wrestle with.
Just a curious question, in your opinion, Rich, if they had exercised the option to ask the customer about a medical exemption of wearing the mask, would that have changed things? That if they had approached the customer and the customer said, I medically cannot wear this, would that have been changed any of the determination, do you think? I mean, they're not willing to do that, but.
Right. Theoretically, yes. If they had asked the customer and the customer said, hey, I've got emphysema, I've got some condition that prevents me from wearing a mask, that's a whole different animal. But I disagree with their approach to this, that somehow that's a precondition to finding a violation. In other words, they're saying that, oh, no, you, Board of Health, you have to go ask the customer, you have to do a physical exam at the site and determine whether or not they're physically capable of wearing a mask. And one, that's not the way the regulation is written, but two, that's an absurd defense to me. In some ways, I kind of liken it to, if you get pulled over for speeding, and you see other cars go by and you say to the officer, well, wait, look, there's other folks. I mean, there's other things going on out there. Don't pick on me. And I just disagree with the approach altogether. They know what the rules are. They obviously are, they've got legal counsel, far more than you. They know what the rules are, and they have made a conscious choice to not comply with the regulation the way it's written.
Well, I also think there's a lot of ambiguousness on both parts. He said something about this puts us in a difficult position because we don't want to antagonize customers, but also, of course, the county health department's in a difficult position because we're told from on high that we have to enforce these things. My concern is not so much with what's been going on with Wegmans, and thanks for clearing that up. I didn't get that was their second offense, because I remember that one that we had before where they refused to sign the guilty determination, but they paid the fine. But my question is, how are we going to handle this as a board going forward when it becomes more and more common? Because when people start getting their vaccines, they're going to stop wearing masks. And if we don't get any directive from the state, this is going to happen on a very frequent basis, not just in Wegmans, but everywhere else. And we're going to have to decide whether we're going to keep going around and finding people maximums for repeat offenses, when it may become very commonplace in the very near future for people to just throw away their masks. So we should think ahead on that one.
I'm just going to add that I think that the state will at some point, I'm sure that they're thinking about this exact scenario as more people get vaccinated, that there's going to be more laxity, but at some point they're going to have to decide how everybody's going to have to approach the issue of mask wearing and distancing, et cetera, as things continue. So I think down the road, it's going to be addressed, and it's going to be a challenge for the state, I imagine.
And the other thing is now, how frequently is Wegmans in particular going to be checked? Are they going to be checked more often because they're repeat offenders, or are they going to be checked on a time frame similar to other grocers and other retail?
So that's a good question. We only go into a store in response to a complaint. So I don't send my staff out just randomly to stores. This is in response to complaints that we receive from customers who are very unhappy that other people in the store are not wearing face coverings. They're afraid that they're going to get sick. And they're very upset. The calls that we get from people are that they want to shop, they have to shop, but other people are putting them at risk.
To Ralph's point, I think if I were to walk into Wegmans without a shirt, a manager would come up to me and say, ma'am, you have to put on a shirt or you have to leave. And if I raised stink, they would call the police and I would be escorted out. And that's because it's the law that I have to wear a shirt when I go into a store. And this is the law currently, that we have to wear a mask when we go into a store.
Yeah.
What I worry about is us litigating things. It's our responsibility to apply the regulations consistently, evenly, and fairly across the board. So I think that's what we need to focus on. As to whether the regulations are good, fair, or not, that's a political question, and that needs to be addressed.
Okay.
But we can't overstep our responsibilities here, and regardless of our personal feelings, just like in some cases that we've dealt with different kinds of health code violations, in which we've been dragged out for long periods of time through various, legal incarnations to try to slow down the process. We have dealt with those things. And I see this as just another one of those matters in which we have to just, keep focused on what is our responsibility, which is to apply the law and the regulations as fairly and evenly as we can. Carry it.
May I ask a question, Keith?
Go ahead, Keith.
Okay, so I think I kind of tend to agree that I do agree that it's not our place to question whether the regulation is good or bad. That's kind of something that someone else needs to do. And Wegmans wants to take to court. That might be a good thing to clarify this. However, I would point out a couple of things. One is that it's kind of a question. Were all the things you said, Rich, were those part of the record? Or those things that came up after the hearing or otherwise, in terms of the stores saying that they refuse to enforce customers to wear masks. I think Rich is frozen, but we can come
I
back
think he's
to
off
that.
the call actually, but
Okay. We come back. I mean, that's an issue that we need to look at. The hearing officer. That's the record. The hearing officer made a determination based upon the record, and that's what we have before us, period. I do like the analogy of a speeding ticket, though. I mean, I think we've all done that, right? We've gotten pulled over and said, well, wait, and the police always says, well, I'm sorry. You're the one who pulled over. However, the analogy is a good one, because when we go then to get a fine, the fine varies based upon circumstances. So our question here, as far as I'm concerned, and it's our only question, is, do we want to reduce the $1,000 fine based upon whatever factors we consider the appropriate? The fact that we're not employees, the fact that I don't know what other facts, or do we want to say no? Look, the regulation was breached. There's no question. The rule says second time's $1,000 fine. I would also remind Steve, and I think Brian mentioned this, is that they did not sign the first consent order. They specifically said, we do not agree with this, we will not sign it, but we'll pay the fine. So I don't know legally if that makes a difference or not, frankly. Do you know, Rich, are you back? does it matter that they did not sign the first consent order and did not agree that they were in violation? They just paid their fine to make it go away.
My computer's having some difficulty. I'm bouncing in and off of the connection here. What they had done with the last consent order is that they agreed to pay the fine, but without admitting any guilt.
Right.
And that, to me, that doesn't really make a whole lot of difference. The issue is, it's a question of notice. I mean, they know that their previous behavior was not viewed as complying by the Board of Health. So this time around, with that knowledge, they continued with the similar behavior, basically because of their internal policy.
Okay. Good. That's fine with me. Then I needed that clarification. Okay. Thanks.
May I ask another question, just for further clarification? If Wegmans was to attempt to enforce the policy, but the customer was resisting, so the store, the business is doing its best to, within reason, to accommodate the regulations and to try to follow the order, how would that be viewed?
Well, I think that's Cassie's point, right? I think it's a good one. If she or I or anyone went in there without shoes and a shirt, they would ask us to put shoes and a shirt on or leave, and if we didn't, they'd call the police.
Well,
right?
what I'm getting at, Keith, is that I know it seems to me that Wegmans' stance is that they don't want to put their staff in any danger, which I can understand. It's perfectly reasonable. But if they were to act within reason, to the point where they thought that there was somehow a volatile situation and they had to back off. But if they did everything within their power to attempt it, including call the police and everything else, would they, and the customer simply didn't comply, would they be held in violation, or would they be held harmless in that case?
Yeah, that would be mitigating circumstance for me. I know if they really did do everything in there. Yeah, but I don't think that's what happened here. But yeah.
I understand that's not what happened. What I'm trying to split this is that the difference between actually trying and just saying, nah, we're not going to do anything about this.
Under the circumstances we're describing, somebody refuses to comply and the cops are called, the cops can escort them out because they're trespassing. It's a moot point because they got rid of the problem. I don't even think they would have I don't think anybody would have called Eileen's office to complain about someone not wearing a mask if the person without the mask had been escorted out.
I'm trying to understand their position in that protecting our staff and our customers, whether their actions, is that or something else, whether they could take, whether smaller, just not as forceful an action, but simply asking, requesting, whether that would be sufficient, or whether they simply maybe feel that they're in a bad position, and why try it all.
I think
go along with Ralph on that, but also if their attorney sat here and mentioned that they made every good faith effort to comply with the regulation, I would have maybe a different opinion than hearing that they just don't agree with it. I don't agree with the speed limit, but I comply. And so I think it's also important to note what Eileen mentioned is that the health department was following up on a complaint from other customers of Wegmans and the population that we're imposed to help keep safe. I can see no argument against that.
So Dr. Archer had supported the claim, and I'm going to make a motion to second that. Anybody opposed? Okay, I Yes, we've moved to accept the claim, Eileen.
Okay, thank you. And I did have some short updates, but given the time that it's late, I will update you next month. So thank you.
Thank you so much. Okay, Kathleen.
All right, hello, everybody. I think I will kind of condense my chatter as well. I know Nancy will speak to our proposed quarantine guidelines in a minute, so I'll skip ahead there. I have no new information right now regarding sports guidance, except that, you know, on the whole, schools have been very compliant, trying to work with that. There have been some situations where we've had some students who've been positive who participate on some teams in various school districts, but we're on it. So testing and vaccination updates. Testing continues. We are partnering with Auburn Community Hospital and providing some symptomatic testing on a weekly basis through the drive-through at their facility at Auburn Community Hospital. Additionally, our emergency management office is still doing a great job working with us and providing asymptomatic testing at Emerson Park on a weekly basis right now, because the interest has reduced somewhat within the community, but it's still there. They're getting nearly 200 people every week. And then there's still the options that remain outside of our county. And if you're sick, you know, we want people to seek testing either through their healthcare provider or through the urgent care centers. Vaccination, we've been hustling with vaccine. Some people are probably more cognizant of that than others. As you all know, there's priority groups for rollout of vaccine. And health departments primarily are asked to focus on a lot of the 1B eligible population. Hospitals are being asked to focus on healthcare workers, as well as the nursing facility, healthcare workers and their residents. Pharmacies are being asked to address older population, 65 and older, at their sites. And we encourage people to go online to see if one of your pharmacies offers vaccine. We are getting shipments. We had a delay last week because of the weather that was occurring across the nation, but we received our allotment from last week on Monday and are receiving an allotment for this week. We continue to ask for more than we're actually able to be given at this point in time, given the supply. The demand is much higher than the supply at the moment. That being said, we are prioritizing. So prior to February 15th, a lot of the groups that health departments were asked to vaccinate were employment-based or residential-based. So for example, Office of Persons with Developmental Disabilities. There's some residential homes. So we were given contacts and we're working with not only OPWDD to vaccinate eligible residents and staff, but we've been working with the employers, for example, grocery stores, school personnel, and others. I'm generalizing a little bit, but that really helped us to not only meet the need that's out there based on public-facing people and public-facing workers, but to try and encourage and keep the focus on Cayuga County residents. It's perfectly acceptable for people to go outside of county to get their vaccine, and we encourage people to get their vaccine wherever they can, right? So if it's going to a state site, if it's going to another county, that's fine. But we're trying to make an effort to serve our Cayuga County residents. We're aware, we've had some discussion about some of the health inequities that exist by ability to get on the internet, by location where you live, and transportation, we know, has always been a barrier to seeking health care. So as on the 15th, when eligibility opened up for health conditions, we knew we had to be able to find some additional manner in which to engage people who are eligible for vaccination, and an attempt to, again, focus on our Cayuga County residents. So in that light, we had a conversation with our town and villages and the city as well. And nearly every town and village office, as well as the city of Auburn, has agreed to keep a waiting list of their residents who are eligible at this time for vaccination. And then what we did with this initial allotment that we got for this week is a portion somewhat proportionally. It's not an exact science, based on town and village census and the city census, a certain allotment of vaccine clinic slots for to be able to register. And those various town and village clerks primarily, but sometimes they've got some additional assistants, are calling the people on their list and helping them get registered. That's really, to my knowledge, is working out very well. This will be our first week trying this venue, but it's the same process that we had done with employers previously, and it worked really well. And people seem to be appreciative of this opportunity. So we're hopeful. Had some conversation this past week with members of some faith-based groups and Human Rights Coalition. And I think we're going to try to provide some additional education and outreach. And when we have the ability to perform some mobile clinics, we're going to try to make some concerted outreach efforts, not only to some churches that may serve more traditionally underserved populations, but also, of course, what we know are some other need groups. Yes, senior centers, but also we know there's a real push eventually to try and get farm workers vaccinated. Unless they meet one of the criteria, they're not eligible yet, but our city partners have been really great, and other partners, right? But it definitely is an impressive collaboration amongst a number of healthcare providers and county departments and city departments and volunteers. It's just been a really impressive gathering to meet the vaccination need. So if you're aware of people who are questioning because they don't see open links to clinics, you have an understanding of why that is the case. And again, encourage people, if you're eligible, get on a pharmacy wait list, look at the state sites, get on a wait list with your town, village, or city. But wherever you can get it first, go and get it. Right, so we also had a conversation yesterday with federally qualifying healthcare centers within our community, because they traditionally serve some of our more vulnerable populations. And I think that was very helpful to know that, what they're receiving, what they're not receiving yet, and how we will continue to work together to serve our community members. So that's really our vaccine update. And then the other to-do list here was our nomination of new officers. We have had our current slate of officers have been in place for 2 years. And we appreciate all of you who stepped forward to do this. Right, so our president is Dr. Kosachoff, our vice president is Ralph Batista, and our secretary is Dr. Brundage. All doing a great job, but as per our bylaws, we need to circulate you out of that particular role. Ordinarily, we get a nominating committee together and then approach people and then send those names for the nominating committee out to our board for consideration and a vote. And I'm happy to do that. I guess I will look to all of you, whether you want to step forward now and offer some names, whether you'd like to put together a nominating committee to perform this. What is your druthers?
Anybody interested in volunteering for any of the positions? Speak up.
No, there's that cartoon where everybody steps back, so it looks like someone stepped forward.
Exactly.
Okay, I got my mouth to work again. Do we have to rotate out after one term?
2 terms, so it's been a couple years, but it doesn't mean you can't be part of the executive board. We just can't have you, for instance, you're in the secretary position, you could be vice president or president, you just can't keep you in the secretary position.
Yeah, if I may suggest, why don't we ask our chair, our vice chair, and our secretary to get together as a nominating committee and come back, because that's a nice clean way to do it, and it allows some consideration. It doesn't put anyone on the spot and so on. So that would be my suggestion.
So we'll ask perhaps our Ralph Batista and Brian Brundage to be part of our nominating committee.
Yeah, and then who's secretary? I'm sorry.
That would be Dr. Brundage.
Okay, yeah, that'd be great. I think anyway. I think that'd be a great way to do it.
And did you want to include our president also?
Yes.
Yeah. And so great. We'll ask our executive committee, by nature of your job titles within your voluntary position on the Board of Health, if you will now be part of our nominating committee, and I'll speak with all of you. If that acceptable to those of you who are on the executive committee that way?
Yes.
Yeah, we can do that.
Great. Well, we'll get together. Actually, if after this, if you have time, I just assume we talk about it now, and then we can get a communication.
We'll stay on board then?
If you can.
Yeah,
Yeah.
we'll stay on board.
Thanks.
Okay.
And that's all I'll report for the moment.
Thank you so much, Kathleen. I guess we're ready for Nancy. Check the mute button.
Wow. Good afternoon. Put forth to you is the quarantine guidelines for school districts that has been updated to contain some new information. And I expect that it will also be an evolution, and we will continue to update this when we have new information, new science. So, the intent is, to get schools back in session and persons in classrooms, and also be safe so that we can continue in the school environment. Do you have any questions about what's being proposed here? Yes, Dr. Joya.
I think the state said that your protective period starts 2 weeks after your last COVID-19 dose. And you got it starting after the second dose.
You know what? I had it, as you so stated, and I was challenged yesterday that it was actually what's in here now. But maybe I need to. I can go back and look at that again, Dr. Joya, and I trust you on that. So I will follow up.
Yeah, that was the last policy I saw, which was last week. They might have changed it since then. I haven't seen a new one yet.
Okay, so I will follow up, make sure it's the most current.
And then it would be, I would think it would be parallel to the disease. It would, biologically, it'd be like 90 days after the 2 weeks after your last dose, since you're, usually you don't test positive for COVID till you've been sick for a week or two. Oh.
Okay. And let's say you have a situation whereby, and I think I know the answer to this, but I want to run it by you, Dr. Joy. If you have a teacher that was exposed in school, had the second dose, but her exposure was in that 14 days, and Therefore, she or he will quarantine for just the time that it takes to get to that 2 week following the vaccination?
Sounds okay to me. And of course, they have to be symptom free.
Yeah, and symptom free. Yes, right. Okay.
Nancy, are these?
Yes, I'm sorry.
Sorry, are these regulations coming right down from the state? So we're just passing them through?
Well, they're coming. Well, there's some latitude that's been given to counties to utilize the information provided by the state and CDC and arrive at this. So, for instance, the change, I think the big change is the proximate. If you recall, schools back in September, we had to enact the proximate consideration. So we would quarantine entire classes. So classes could not be held. And now what we're given the liberty of doing is quarantine, requiring those just around the positive individual.
The part of it that I don't really like, and I don't know how much leeway there is to work with this, is this 90-day. That am I to believe that after 90 days after one, like a student has a positive test, they are now back to square one and they are no longer deemed protected? And similarly with the vaccine, that after you've had the vaccine for 90 days, you are subject to quarantine again? Is that the way I read it?
Hopefully before we get too far along here, there will be new guidance. But right now, my understanding and my research, and then coming from the state and CDC as well, is there's not enough study out there to say the efficacy of the vaccine after 90 days.
It's because it hasn't been around that long.
That's right. So it's suspected to be so.
If that's the way they're going to keep it, we're never going to end this ever, because
they're
resetting the clock on everybody.
Could be like the flu vaccine.
Well, is it though?
So the last I know that there are some studies that are about 8 months old looking at persistence of antibody post-vaccination. And it looks like people seem to retain those antibody levels 8 months post-vaccination. So, but I don't know if that's been incorporated into the new recommendations yet.
It hasn't. I do think this will be changing as soon as we get that new information.
Is the 6 feet distancing coming from New York State at this point?
Yes. Yes. I know there's been a lot of discussions about that, but yes, 6 feet. And some schools are challenged with that for the number of students they have.
Yes.
Well, if you had a bunch of students that had already had the disease in less than 90 days, and you had teachers that were vaccinated in less than 90 days, it would seem to me like you wouldn't have to do the 6 foot or the masking rules. So that's how we got to figure out how to dovetail into this, so we can look forward to the end of all this stuff. Because at some point it's got to end, otherwise it's just never going to end. And I know that we have to follow the state guidelines to some extent. There is leeway. Then we need to figure out which way we're going to lean on that, so we can get kids back to school.
That is absolutely true, but we can already see, and we're glad that we are able to do the sports. It's a wonderful way but we have cases in those teams now. Some teams we've got it. So I think we have to, be reasonable, but with your goal in mind is that we get kids back into school every day, So
do we need to motion to approve these, or?
I think I wanted your feedback and wanted your approval for this. And I talked to one superintendent, and I certainly have talked to a number of others. I think they're going to be very happy to see this, to tell you the truth.
I motion to approve.
Can we put a caveat on that we're going to revisit it in 2 months, because that's less than 90 days?
That's great.
And revisit the guidelines in 2 months?
because I'd like to see how this progresses. I'm forward thinking on this. I want this to end. Everybody wants it to end. The harm of kids not being in school is drastic and ongoing. And if we just keep, pushing the can down the road, like, okay, 90 days, we got to start all over. I think we should keep on this and really look forward to being on the front edge of this. So I'd like to revisit it in a couple months.
I'm sure that these things are going to be changed as more information comes out.
Then it'll be an easy revisit.
Right. So Cassie,
With the motion, I will second Cassie's motion.
thank you. Any opposed? Okay, the motion carries. Anything else for us, Nancy?
Yeah, I just will only say that I think since it feels like 10 years, but it really is only a year, that we have taken responsibility and been accountable to accept the new science and anything to update and stay ahead of it and stay on top of it and trying to educate our community as well. I think that is a big piece of what we felt we are so responsible for. We cannot set on laurels, can't set on a policy because we've got it done. No, forever changing it up to whatever new information is coming.
You're here.
Very good. Thank you. Anything else for us then, Nancy?
No. That's good.
Okay. Thanks. We have a couple minutes. Let's move on to the medical director's report. Dr. Joya, thank you. Sorry.
May I say something first? I'm sorry. I just wanted to see if we could motion to support the increased compensation for Kathleen and Nancy and Eileen, given their significant work and service during the pandemic. If we could support that as a Board of Health.
I'd motion that. I'd second that.
I'll third it. And fourth it.
Yeah, I'm in favor.
Thank you, Cassie.
All right, now I'm done.
Thank you. That's nice. Thank you.
All right, Dr. Joya, the floor is yours.
Okay, I'd like to also commend Kathleen and the regular health department staff for been intelligent, perseverant, and done the best with the resources they've got, I believe. On the quarantine business and schools, like general principle, hope for the best, which will be persistent antibodies and increasing vaccination rates and decreased disease, but always plan for the worst, such as the variant strains that might be relatively vaccine resistant and sometimes worse than the present disease. So, certainly revisiting in 2 to 3 months, we might be able to do better, but it might be worse, but we'll say that'd be a good thing. It looks like the vaccines are going to come out more, though. The Johnson & Johnson vaccine that'll probably start in March. There's going to be a hearing on FDA hearing on Friday. Probably will get approved, but their production is less than they thought they were going to have, and and certainly it's been a demand around the world. As our rates of the COVID disease go down, will probably be humanitarian and some more benefits to spreading the vaccine around the world. So it's a secondary thing, but hopefully our rates will go down and the vaccine will be ahead of the disease before it resurges. That's the major stuff, and always everybody knows with this weather, there have been injuries, motor vehicle injuries, and patients at skiing and recreational, being careful as usual.
I think we're done, John.
Okay, I'll entertain a motion to adjourn the meeting.
Ralph
Okay,
did it.
thank you. All right, we'll see you next time. Thanks for attending.
Bye-bye.
Thank you, Ralph and Dr. Kosachov and Brian Brundage could stay on, that'd be great. But live.
Yeah.